why sometimes researchers can just be a little bit too pedantic. And what do I mean by that? Well, part of this test is to see the neck. When you do it, you're going to do a flexion. It's passive, completely passive. It's a full flexion and then rotation slowly to either side. If the neck does not go to 44 degrees, it's considered abnormal. Not 43, not 45, 44. So I make a little fun of this because this poor sap has a goniometer strapped to his forehead. Unless you want to see 3 patients a day, don't do that to your patients. We cannot eyeball anything 10 degrees or less. So eyeballing is fine. So it's 10 degrees difference to either side, or 44 degrees is the norm. Why do we flex the neck? Well, it's a cervicogenic headache, upper cervical headache. And so flexing it takes the lower part of the neck out of the equation. It isolates the upper cervical segments. So when you fully flex the neck, and that's one of the most common mistakes, students tend to kind of, when they're concentrating, they'll let that head droop down, and then, oh wow, 90 degrees, man. This is a real flexible neck. It's a false negative. Take it up, focus, hold it there. You don't have, just common sense, right? Fully flex it. Do it slowly. Then when you get them up there, while they're up there, you turn them one way, then the other. Haley, can I show your classmates, please? Sew on your back for me, please. So Haley comes into me with suboccipital headaches, and her neck's tight, and she's tense. She's been studying for exams, boards, we'll say. And she's just got a really dull, tension band-like headache. Nothing malignant sounding. No photophobia, phonophobia, nausea, vomiting, speech, visual, hearing disturbances. She just got a doggone headache, and her neck feels tight. She's always wanting her classmates to rub her shoulders. To me, that's a cervicogenic headache until otherwise proven. First thing I do, I don't like to say grab, obtain purchase on her neck, and I gently flex it until I feel and feel. I don't need to go any further. Then, while I'm doing that, I slowly turn it one way. Once I get to about 45 degrees, I stop because the standard's 44. Why go to 80? Good. While the neck is flexed. So she's got a normal CFRT. Now, here's what we see. We see this and then normal. But I didn't lock out that lower cervical spine. I want it locked out. Isolate upper cervical. And then just take it to about 45. And about 45. Notice I'm not in a hurry. What you're looking for is an end feel, or the patient grimaces and resists you. That is what we would call a positive cervical flexion rotation test. So here's, 44 degrees, that's what I mean by pedantic. It's just kind of silly, isn't it? But anyway, this is how I would suggest you do it, is that way. Fully flexed, and then slowly rotate to one side, and then the other side. The data, look at the sensitivity and specificity for that test. It does not get a whole lot better than that. And there aren't a whole lot of tests for the cervicogenic headache. And you fix somebody that's been to all the neurologists in town, as competent and wonderful as they are, what one knows, one sees. So if they don't think about function, if you went to an osteopathic neurologist, one of my best friends is an osteopathic neurologist, he gets this. But allopathically trained physicians, they're not getting a whole lot of biomechanics. It's not their fault, and they're not bad people. I don't know a whole lot about which is the latest antibiotic to use for strep throat. I stand plain. Fair enough, who cares? But if they don't check for this, if you check and find restricted upper cervical region for cervicogenic headaches and you do a few manipulations, I don't want to be over dramatic here, but I'll just say your patients will kick through brick walls for you. They will go out into the street. They will grab people by the hair and drag them into your office because they have been given drug after drug after drug. They've been sent to the psychologist for biofeedback. They've been sent to PT. They've been sent to massage therapy. But if you don't know to look for it, you're not going to find it, right? So let's try the CFRT. Just key is when you flex, don't push it too far. Keep it there and then turn slowly one way, then the other. Again, 80 degrees is no better than 45.